Welcome to SAHEL, your weekly window into the digital transformation of the state of Kuwait. Join us as we explore the latest advancements, interview key figures, and highlight positive progress towards the new Kuwait. Get ready to be inspired and informed as we celebrate the remarkable transformation that's shaping Kuwait's future. This is SAHEL, where progress meets potential. Hello and welcome to today's episode of SAHEL. In this episode, we have an exclusive look into emergency medical department at the Ministry of Health. In this episode, we will take you behind the scenes of this remarkable emergency department, exploring the innovative technologies they employ, the challenges they face, and the impact they have on the overall process of digitization in the state of Kuwait. But before we dive into the details, we have an intriguing report that's lined up just for you. Today, we will focus on the historical establishment of the emergency medical and its initiatives towards building a safer, digitized Kuwait. So stay tuned for more details.
The Health Ministry announced the launch of Emergency Medical Services, Current Reality and Future Aspirations Conference under the auspices of Minister of Health. In a press statement, Director of the Emergency Medical Service Department, Dr. Ahmed Al-Shatli, said that the conference would include 10 sessions covering 40 scientific papers and 3 workshops. He pointed out that these sessions and workshops will address how to determine dangerous professions, occupational risks, and the allowances distributed by the Civil Services Commission. It would also be handling the quality, accreditation, and governance of services provided through leadership, sustainability, and quality. Several emergency technicians, doctors, nurses, paramedics, and trainers in the Ministry of Health, along with oil, military, and academic sector, Patients Helping Fund, the Red Crescent, Kuwait Crises Management Center, and others would be participating in the conference. Al-Shatli called on all doctors and workers in the medical sector to seek benefit from the annual Emergency Medical Conference.
Before we dive into an exclusive and captivating conversation with Mr. Osama, Yousef Almethen, let us take a moment to explore the remarkable journey of today's esteemed guest. Now that we have gained insight into Mr. Osama, Yousef Almethen's background and professional journey, it's time for an exclusive conversation with our exceptional guest. Mr. Osama, thank you for joining us here today.
Thank you for having me on your show.
Mr. Osama, can you please start with telling us more about a medical emergency and what is it?
Okay, Yousef, the emergency medical service actually, it's the first responder. So when someone who's in need for help, medical help, if they are injured or they are sick or they need any medical attention and they're not able to reach hospital or reach a clinic or something like that, then they call for help, and that's where comes our role as an emergency medical services to provide them with the medical services and the pre-hospital care at the scene if it's an accident or if it's in a home or anywhere. Anywhere, it doesn't matter if they are at work or at the beach or whatever, at the chalet or mukhayyam or anywhere. We are there to provide this pre-hospital care and to diagnose and treat on the scene and then transport the patient if they need to be transported to the nearest hospital.
Are there any other services provided by this department?
Yousef, this department has so many services. Let's talk about the serious role of the emergency medical service, which is saving lives. And to save lives, that means we have to act fast. And as an emergency department, we have a section, as we call it, emergency section. Emergency sections, they have ambulances vehicles and they have air ambulance helicopters. Air rescue is it's new to the department. It's been around for about 10 years or so, and it helps so much as far as time-wise. Instead of taking a long time to reach the scene or to reach the hospital to transport the patient, and we will cut that in almost 90% of that time. So response time is very important for us, and this is the main service our department provide. There's other services like a BTS service. BTS is a patient transportation service, which means if the patient just needs a transportation, for example, someone who has an appointment and they need to go to the hospital for their appointment, but they are unable to get there because they are elders, because they are handicapped or special needs, or any reason, for any reason they could not go to their appointment. They could pre-schedule a time and a date and where they're going, what's the situation with us, and we can happily provide them with the transportation to the hospital and back to their home. And sometimes doctors and hospitals request transportation from one hospital to another hospital. It depends on the case. You know, sometimes in this hospital there isn't the method of diagnostic department. It doesn't exist in that hospital, so they have to go to another hospital, especially hospitals who have injured people, let's say fractured, and people who have severe fractures and multiple fractures, and they need to do an intensive diagnostic analysis. Then they have to go to Al-Razi, for example. So they cannot stay in the local hospital of this governor area. So we do that. We take them to the Razi and then they take them back. There's so many episodes like that. So patient transportation services, it's a service that only required EMTs, emergency medical technicians, to be on the vehicle, on the ambulance vehicle, to just make sure that this patient transport back and forth in a good well. We have another transportation, which is, we call it MICU, which is motor intensive care unit. It's a big vehicle. It's just like an ICU room with all the equipment of the ICU inside that vehicle, and the staff that goes out on that case would be a doctor, nurses, EMTs or paramedics, with the patient going back and forth if they need to transport them somewhere and then bring them back. So we have so many services that concern a patient's health, and other services in the department, let's say for the training department in our department. It has what we call it a service where we provide first aid training courses for the public. That's another service that we provide to the public. If anybody wants to learn how to provide CPR and how to deal with injured people and how to respond to an emergency, they could take a first aid course in our department, as well as the other departments that try to improve our techniques and our skills and the EMTs and paramedics to provide the best healthcare, pre-hospital healthcare to anyone who needs attention.
Mr. Osama, now that you've told us about most of the services that are provided by the medical team, let us know about the mechanism of those services provided by the medical emergency team.
Of course, Yousef. The mechanisms that we work with in our department has two mechanisms. It's either working shifts, which means 24 hours work and then 48 hours off. It's a normal shift that most of the ambulance services and or most of the ambulance centers works in this technique or this method of working procedure. And there's another technique which is day job, which is working only from early in the morning, 7 o'clock, 7:30 until about 1:30, 2 o'clock. The normal timing, working hours. And of course, the mechanisms also it requires so many departments in our EMS department. If they are working morning hours and they have to also be there and the rest of the day, sometimes they have like 1 or 2 people, or sometimes 5 people, 6 people, depends on the section that they're working at, to provide the services for our EMTs. For example, if you are working in the Department of Supplying, and if any ambulance centers have little shortness for any reason, and most of the time they don't have that kind of shortness, but if happened, we always prepared that somebody there in the supply department to provide this piece or this equipment for them if they need it. And other departments also, they work around the clock. So basically, the mechanism work of our job as EMTs or paramedics or emergency medical service is working 24/7. We never stop, not for holiday, not for any reason. This department is working all year round.
How stressful is it?
It's very stressful, actually.
Especially working a 24-hour shift.
Yes, it's very stressful, and especially certain department or certain ambulance centers that they face so many, let's say, emergency cases. Not only calls, emergency cases, road traffic accidents, cardiac arrest, hypertension, all these serious emergency illness that they deal with, and especially road traffic accidents, because dealing with road traffic accidents, it actually gives the paramedics what we call a post-traumatic syndrome.
PSC.
Yes. So afterward, they become like so much involved in that accidents, and they need to get rid of that. So we always advise them to, after you finish with this case, you have to sit with someone you can trust, someone you feel comfortable with, maybe a colleague or a member of your family, or anyone who you feel you are comfortable with them, and talk it out. So you can go back to your shift after 2 days fresh.
This is a very serious topic, let's say, especially road accidents. Main accidents are happening these days are from phone usage. Is there something you'd like to add to people, since you've seen a lot?
That's right, Yousef.
And inform them how serious it is.
We always try to advise people, do not use your mobile while you're driving. You could put it on a stand, put an earpiece, you could do so many things, but please don't text and drive. This is the worst thing. Most of the accidents we've seen for the last, let's say, 10, 15 years is because the main cause is losing concentration on the road because they are too busy texting, using their phones. Exactly.
Well, thank you. Let's move to the paperless edition. I've heard that the emergency services have gone paperless a while back, and they also added more services recently. Is that correct?
That's right. Our department is trying to keep up with the technology, and especially communication technology, and trying to cut the time down. And when you are doing this, you don't need so much paperwork. So paperless technique, we started, let's say, maybe around 15 or a little more, maybe 17, 18 years old, 18 years ago. That's when we started communicating between our departments by emailing. And this is how we started, using an email. It's provided by the department and the Ministry of Health, and this email is just as good as an authorization. If anyone who wants to get, like, let's say, a vacation, want to go on vacation, he wants to excuse for a couple of hours, sick leave and all that. But with time, because the time now, it's we have what we call SAHEL, and we have all this new technology where we can go and go online and request these things, made it so much easier for us. So even for us as an emergency medical department, we have a server with a let's say a huge storage that we can store everything up to 5 years, and it's automatically will erase itself. And hopefully we can do that for even with all the cases we go to them, especially when we try to let's say write a patient report. The patient report, our EMTs and paramedics, they do it by hand and they enter it into the system. So hopefully in the future, this is one of the things that we hope so, that even the patient report will be automatically paperless and we don't need to do it on paper.
True. Time is very crucial, especially in your line of work. Hopefully things are going to be more intelligent and faster, especially within the paperless field.
That's right. Intelligent, fast, and simple. Try to make it simple, try to make it usable, try to make it available to everyone, understandable, especially for the young EMTs and paramedics. They are, mashallah, they are very smart, and they are more open to technology and more open to telecommunications, more than my age, let's say, or the older ones, that we still have that idea where we need to do paperwork, but hopefully everyone will understand that papers now is just like as good as systems and screens and tablets or whatever. These are all documented, and they're all you can go back to it and you can save them, and you can put a backup and back up to the backup. So this is all hopefully there, and inshallah with time we will see a day that we won't see any paper.
Well, Mr. Osama, you actually put the foundation, and us new learners are actually learning from you and from the previous generation, and thank you for putting the correct foundation that made the paperless move sound easy to us. But if it wasn't for your excellent foundation, it wouldn't be there.
It was our duty back then to build that foundation to the new generations, to the future.
We'll take a look at this quick report and get back with more questions. The Director of the Medical Emergency Department has officially launched the paperless system in the Operations Department at the onset of the new year 2024. This initiative aligns with the Ministry of Health's digital governance plan, expanding the system to streamline the reception of reports and the dispatch of ambulances. Now we bring you an exciting report. Stay tuned.
Director of the Medical Emergency Department, Dr. Ahmed Al-Shatli, has officially launched the paperless system in the Operations Department at the onset of the new year 2024. The initiatives aligns with the Ministry of Health's digital governance plan, expanding the system to streamline the reception of reports and dispatch of ambulances. Expressing pride in the dedication medical emergency team, Dr. Al-Shatli acknowledged their significant contribution to Kuwait's health service throughout 2023. Highlighting key performance indicators, the Operation Department handled 185,000 cases, including 128,000 hospital transfers, 8,757 road accidents, 808 air ambulances, 94 medical evacuations, and 753 cases through the ports. The department is extremely active, participating in 72 training exercises and provided support to 6,662 events and gatherings. Dr. Shatti noted a notable increase in air ambulance cases, a 100% rise from 404 to 808 in 2023. Support for public gatherings and activities also increased by 20%, reaching 6,662 in 2023, compared to 4,418 in 2022. Moreover, mock exercises saw a 30% increase, totaling 72. The average response time to reporting sites stood at an impressive 10 minutes. Looking ahead, Dr. Shatti expressed optimism about future projects within the administration department. He aspires to enhance efficiency, save time, and improve services through the implementation of the paperless notification system. The department aims to utilize advanced medical guidance system, activate non-urgent reports through any easy program, and establish communication channels between ambulances and accidents and emergency departments.
Ladies and gentlemen, welcome back. And now we're going to get back with Mr. Osama Almethen with more questions. Mr. Osama, can you tell us more about the home visits / services that are provided by your emergency medical team?
Okay, as you said, home visits / services.
Correct.
So this service is provided for the elderly. If they are in need for anything to be done at home, and by organizing this with the, let's say, the hospital that they get treated or they get their medication or whatever treatment, and sometimes we need to take their doctor to go with them. So yes, we thank the Minister of Health, Dr. Ahmed Al-Aradi. He gave us that green light to go ahead and provide that service and visit our beloved elder people at home to show more concern to them and to give them what they need as in health care. And of course, most of them, they don't like to go to the hospital, Yousef. Most of the elder people say, no, please leave me at home, and if you want to give me anything, just give it to me at home. And sometimes it's just a small procedure, so changing catheter or whatever. You could do it at home. We could do some kind of procedures. Some procedures it requires emergency nurses, and we have emergency nurses who work with us, and they can provide those services. And some of them, they need actually either an emergency doctor or a specialist. So we could even communicate with these kind of servers, and they could come with us, and we take them to the patient at home and see if the situations it can be dealt with at home, and if not, then we have to convince them to take him to the hospital. But yes, again, thank you, Dr. Ahmed, our Minister of Health. He gave us that something that we would love to do for our elderly. They are, let's say,
our
they
foundation.
have all the right to give that service. and it makes us really happy actually to visit them. Even our EMTs, even younger EMTs, male and female, I always call them our heroes. When they go out for an order or a request like that, they go there and they are happily to provide the service and to go and with a big smile and try to give them what they need at their home, at their comfort of their area, their place.
Well, as you said, we'd like to thank the Minister, and we'd like to also thank you and thank all our young heroes out there providing this service to our families out there who are in need of those services. Mr. Osama, let's move to the innovative technology. Are there any innovative technologies in the ambulances currently?
Actually, Yousef, our new ambulances, we have a little more than 280 ambulance vehicles that just recently introduced to the service. And they come up with a state-of-art technology and all the newest model of equipment and machinery, and they made it a lot easier for us to provide the help, and made it even easier for the patient to be comfortable inside the ambulance vehicles. The technology it's made to make things easier, and of course to provide an accurate diagnostic, and this is what we look for actually. When you try to diagnose a patient, you need to have the equipment and the tools that can give you 100% accuracy. And it's pretty hard to get 100%, but at least as close as 100%. And this is the technology we have right now in our new ambulance vehicles. And of course, with lifting and handling the stretchers and the trolley and the weight of the patients, also they made that a lot easier by providing trolleys that's hydraulic, and made it easier for the EMTs and paramedics, and of course for the patients to feel comfortable and safe when they are laying on this stretcher.
Mr. Osama, tell us more about the challenges that are being faced by the department itself.
The challenges, Yousef, I always say our main challenge is time. So
Correct.
when we get a call, and this call is serious and it's an emergency call, we need to get there as fast as we can. And you know how Kuwait's roads are always trafficked and always jammed. So we always ask our beloved people on the road, please open the way when you hear the sirens. Open the way when you notice the flashes of any emergency vehicle, ambulance, police cars, fire brigades, any emergency vehicles. Try to help us to get there as fast as we can, because the person who is in need for our help, this could be someone you know, this could be someone a close friend, a close member of your family, someone you love. So for us to get there and to provide the help and give them the care of medicine and save their lives, it depends on how fast can we get there. Another challenge is to provide us with the exact location. That's another thing, Yousef. Sometimes people, they get panic and they get confused. They don't give the exact location or the correct location.
They need to calm down, give you the exact location.
Exactly.
And for the people on the roads to just steer away from any ambulances or any other services, emergency services on the road.
Exactly.
Mr. Osama, we're going to take a look at this following report and get back with more questions. The Ministry of Health have marked a significant milestone by inaugurating a new fleet of ambulances at the Ministry's Transportation Department that we spoke about earlier. The fleet comprises of 79 fully equipped vehicles, all serving as comprehensive intensive care units, with an additional 10 ambulances that are specifically designed to navigate rugged terrain. More follows in this following report. Stay tuned.
The Minister of Health, Dr. Ahmed Al-Awadi, marked a significant milestone by inaugurating a new fleet of ambulances at the Ministry's Transportation Department. The fleet comprises of 79 fully equipped vehicles, all serving as comprehensive intensive care units, with an additional 10 ambulances specifically designed to navigate rugged terrain. In his address during the inauguration ceremony, Mr. Al-Awadi expressed his satisfaction at the deployment of these ambulances, emphasizing their crucial role in bolstering the emergency response system to serve patients effectively. He highlighted that the designated crews have undergone specialized training to ensure the safe and efficient operation of these vehicles. Dr. Al-Awadi announced plans to introduce another 100 ambulances later this year, citing their status as the most modern and advanced vehicles equipped with the latest electronic connectivity technology. This initiative underscores Kuwait's commitment to modernization in its healthcare infrastructure to meet the evolving needs of its citizens. Assistant Undersecretary for Engineering Affairs at the Ministry of Health, Ibrahim Al-Naham, underscored the collaborative efforts between the Department of Transport and Medical Emergency in implementing the ambulances. Al-Naham emphasized that the vehicles sourced from the United States adhere to the highest specifications, ensuring optimal performance and reliability. Dr. Ahmed Al-Shatti, director of the Medical Emergency Department, described the inauguration as a historic milestone in the department. With the addition of these ambulances, Kuwait's fleet now totals 281 vehicles. Al-Shatti emphasized the department's commitment to achieving rapid response times, aiming for an average arrival time of 7 minutes following notification.
For a final question in today's episode with Mr. Osama. Mr. Osama, is there anything you would like to add?
Well, at the end here, I would like first to thank our colleagues and our heroes of EMTs and paramedics who they try to devote their time and life actually rescuing their lives and rescuing everything to provide this health care to anyone who needs help and to save their lives. And of course, also I would like to thank our director of our EMS department, Dr. Ahmed Shatti, for backing us up and for always giving us a lift up and trying to be there with us in any situations. And for you as dear viewers, please try to open the ways for the ambulance vehicles, try to be cooperative. If you know there is an emergency, you are sure there's an emergency, then call 112, don't hesitate, call 112 right away, only if you're sure there's an emergency case, because sometimes we get calls and actually it's not an emergency case. And again, for us as a patient transportation service, you could call also 112 and schedule a date or time for transporting your patient to a hospital or any situation that you have. Some of them, Yousef, actually they have a plane that they have to travel to get medicated somewhere else abroad. So also we provide that service as well.
Mr. Osama, thank you so much for your time and for joining us here today. And we'd like to thank you and all of our heroes out there putting their lives in danger to save other lives. Thank you so much for being here.
Thank you.
Well, as we bring this episode of SAHEL to a close, we sincerely hope that we have offered you an engaging insight into the ongoing digital transformation that's occurring right here in the state of Kuwait, from the cutting-edge electronic services provided by government entities to the ambitious objectives that are outlined in the new Kuwait's vision. We have explored the remarkable advancements that are shaping the future of this nation. However, our journey doesn't end here. We invite you to join us again next week for an exciting episode of SAHEL, where we will delve into yet another captivating topic. An upcoming infographic will provide you with a glimpse into the subjects we will be covering and the inspiring stories we will be sharing with you next week. Thank you for joining us, and until we meet again, goodbye.